Dr. Giuseppe Caruana, also known as Dr. Joe for short. I'm the chiropractor and clinic director here at Full Function Rehabilitation and Wellness. Today in this short video I just wanted to talk a little bit to you about low back pain. Low back pain is very common in North America. 80% of the people have been documented with having low back pain. Either have had a previous spasm or flare-up in the past or currently suffering with low back pain. Very common by motor vehicle accidents, workplace, or just normal wear and tear of the body that usually causes back pain to develop. If you look here at the spine, the low back is predominantly from the bottom of the thoracic spine, which is your mid-back, all the way to the top of your sacrum. This portion here, there's 5 lumbar vertebrae that all stack up together to form your low back. Now, what usually happens to cause a low back is the individual joints into the spine, either one side or the other, left or right, are not moving properly. This is a lack of motion. Now, this lack of motion causes tension, causes spasm to develop in the muscle. It causes the muscles that attach to those joints to now have to be pulling harder to get you to move more grossly. And what happens is accumulating effect over time leads to a really increased lack of motion in the joint, and then pain develops and spasm as well into the muscle. So how I commonly treat my patients here at Full Function is I use 4 techniques, but I'm going to talk about 3 of them today. 2 of them are muscular techniques, the other one is the chiropractic adjustment. The 2 muscle techniques are active release technique, also known as ART, or Graston Technique, which uses stainless steel tools to rub out the specific area of complaint or the fascia to decrease the complaint, to decrease the pain. I also use the chiropractic manipulation to help increase joint motion, relieve stress on the joint, and allow the body to naturally heal itself. So first I want to talk about the Graston Technique. What it is, they are 6 stainless steel tools. Now these stainless steel tools, as you could tell, are all contoured differently. Now what they do, they contour different to accommodate different portions of the body. Now I know it looks very invasive, but it's very gentle technique. And what you do is you apply lotion, particular Graston lotion, to the skin, and you grab one of the tools and you're just kind of rubbing the tool onto the skin. And what it allows to do, almost picture this tool as an iron. It helps to iron out the tissue, iron out the fascia, and the fascia is a saran wrap that covers the whole muscle, and it pretty much encases the whole body. So this helps to kind of iron everything out and relieve the tension in certain spots. The next muscle technique is called active release technique. Originally designed for athletes, but now we use it as chiropractors and to the general public. Very, very common technique to use. It's very effective. It is slightly painful because it gets in pretty deep into the problem area, but it's very effective. The next one is the chiropractic adjustment, which all 3 I'm going to demonstrate shortly on a patient and show you the difference between all the different techniques. Okay, so here we are having the camera zoomed in on a low back, and I'm going to demonstrate the first treatment of active release technique. So if I can have you cross your arms around your chest, give yourself a nice big hug. And what I'm going to do, I'm going to be placing my contact onto the low back with my thumb, and I'm going to give the patient instructions where pretend you have a ball in your abdomen. You're going to roll over that ball and you're going to twist down like this. This really targets the lumbar paraspinals in this position, which are usually one of the most basic culprits of the muscle affected with low back pain. So here we are. I'm going to place my hand onto the low back. We're going to get a little bit of tissue tension, and we're going to have the patient drop down and twist just like that. So basically the pressure that I'm applying to the low back is what's giving it its tension, and as the patient moves through the range of motion, that's the active component, giving the name active release technique. So what we do a couple passes onto the low back in different spots where we have the affected muscle region. And then we change it up to a different muscle to see where the next one is mostly affected. Okay, great. The next one we're going to talk about is the Graston technique. So the Graston technique, as mentioned, uses stainless steel tools and this cream. The cream gets applied to the skin just to avoid any friction with the skin. And basically what you're doing is you're stroking the tool over the skin into particular muscles to help release the tissue tension. Now what I like doing, I like incorporating both the active release and the Graston, where I'd have the patient do the same thing, kind of bending down and twisting down to this side, giving the muscle a nice stretch while I'm rubbing out the fascia and the muscles with the tool. Now it's very common to have a little bit of redness after the treatment. It's very common. It's just because of the abrasion that's occurring into the area, but there's really no harm done with this. This next portion of the video, we're just going to explain the chiropractic adjustment, very commonly seen with patients lying on their side to adjust their low back. And what we do, we bend the top knee, we tuck it right in behind the other knee, slide the patient towards me, and I just position them in a way that I need to target the low back in specific segments to get the appropriate one to manipulate properly. So the patient lies like this, and this is the common chiropractic adjustment setup for the low back. Very comfortable, very easy, not much twisting involved, and it allows the popping sound that you usually hear, and it's very comfortable and really helps to the low back. Well, thank you very much for tuning into this video. Please stay tuned for some next videos that we're going to be talking about how ART or Graston and the chiropractic manipulation can be utilized on different parts of the body, different joints, different areas of pain. Thank you.